Well, hello, everyone, and welcome to another episode of You've Got the Power. I'm your host, Dr. Jason Deitch, and of course, we are here with the Chief Medical Officer of the Centeno Schultz Clinic, Dr. Centeno himself. Happy Monday, Dr. Centeno.
Happy Monday.
All right, we got a great episode coming up today. We're going to continue on the conversation of what's happening up over here. Today's conversation is really all about basically how dizziness, lightheadedness, even imbalance might be coming from our neck. We talk about it in a variety of different ways week after week about the importance of the mind-body connection, all the neurology, the brain stem, the spinal cord, all going through the sort of upper neck area. Dr. Centeno, let's keep talking about the different effects that interference in the upper part of the neck or ligament laxity can be having on people's symptoms and their overall health and well-being.
Sure. I think the big issue here is that we've got a collection of symptoms that we're going to talk about today: dizziness, imbalance, lightheadedness, that can steer the average physician in lots of different directions. Everything from this is coming from the inner ear, so that would be an ENT physician, or this could be related to a stroke, so that would be a neurologist and doing an MRI of the brain. And then we've got this other thing out there, and that is that these symptoms can be caused by the upper neck. So, all too often people who have upper neck related dizziness or imbalance end up getting through those other pathways. Tests are done, those tests are largely normal, and then everyone's scratching their head. So today we're going to talk about a little bit about those symptoms. How can they be related to the neck? How does that work? And if you know people out there that have these kind of symptoms, and again, the workups have been done and people are scratching their heads as to which direction to go, that's really the time when you want to get this kind of Facebook Live video in front of them.
It's such an important point you just bring up because, when people start feeling symptoms, it's often a mystery as to where do I go? Who do I see? What should I do? And the way most people have been trained to make that decision is to typically, basically go to their insurance and go to their general physician as a place to start. Now, when your knee hurts, it's pretty linear, knee hurts. But when it's these more types of, I guess what I'll call organic type symptoms, dizziness that comes and goes, imbalance that sort of comes and goes, it's not as linear as, my shoulder hurts, my back hurts, and it can be coming from a variety of different things. Dr. Centeno, help people understand sort of, do these symptoms come on, immediately and then you feel them? Do they come on gradually over time? Is there sort of certain clusters of this and that oftentimes, work together? How does somebody know who they should see for these types of symptoms when it would seem, it's my head that's dizzy, I should see a head specialist? And they think that in the linear terms that most people are used to.
Yeah, now sometimes these things can start after trauma. Sometimes these things can start, a distance after trauma, sometimes not related to trauma at all. So that's the first thing. And the second thing is talking a little bit about where all this stuff can come from and why or how could it be related to your neck? Because I think we often think of, for instance, dizziness has to be an inner ear thing, or maybe a thing related to a stroke. Those are the two first examples I brought up. But if you look at how the balance system works, it takes input from your eyes, your inner ear, and your upper neck, and it has to, that's sort of a triple redundant system, right? We all maybe remember those terms from the NASA space program. When they sent the astronauts to the moon, there was redundancy built in, meaning multiple systems that were supposed to do the same thing. In case one of those systems broke down, the other two would still be available and the astronauts wouldn't die. Same thing in your body. There's a triple redundant system for balance. So the first is that you've obviously got your inner ear, which provides information about head position, body position relative to the gravitational field. Then we've got information coming in to the eyes, and that information has to be consistent with the information coming into the inner ears. The eyes would say, well, I'm looking at the horizon, and the horizon is this way. And then finally, there's information coming in from the upper neck that's got to be coordinated with those other two. So uh, a common thing where we get information mismatch that we've probably all experienced is when we're on a boat, right? We're on a boat, we're above decks, we're looking at the horizon. The horizon's going up and down, and most of us are fine with that. Our inner ear is saying the world is going up or down. Our eyes are saying the world is going up and down. But then we go below decks, and all of a sudden, the horizon isn't moving up and down. So the eyes are giving us one message, but the inner ear is giving us a message that the world is still moving up and down. So a lot of people will get sick or ill or nauseous with that message. And so that's a great example from your daily experience of how those three systems have to talk to each other, and all of it has to agree in order for you to feel like you've got good balance.
That is essential. I know from my experience as well, the writing reflex is if things are off, the body will sort of get its head so it is in alignment with the horizon, but will adapt the rest of the body to do whatever is necessary because it's so important to kind of get that horizon line and kind of a basis of what should be normal according to the way the brain processes information. Let's go to some questions. They're coming in early, so let's bring Marie Bordelot on. She's asking, can C2, C3 type instability also cause dizziness, or is it always a CCI type injury?
No, that's an incredibly important question, because at the end of the day, it's really the entire upper neck. So C2-3 can cause dizziness independent of any instability. So for instance, many times in a rear-end car crash, the C2-3 facet joint will get damaged as a result of the forces of the crash. And many of those people have headache, but also dizziness or imbalance. In fact, there was an early study from radio frequency, where that's where you burn the nerves that take pain from the joint, where they did an incomplete lesion of the C2-3 facet joint and published some really bad results where they made people permanently dizzy. Now, eventually that got fixed as they figured out how to do more complete lesions of the C2-3 joint, but it was a great example of how that joint by itself can lead to substantial dizziness or imbalance.
It really is. And the other thing, logically, if people want to kind of understand the mechanisms, there's the local sort of joint. There's nerves that come out at local levels, blood vessels at local levels. But you'll also notice that C1 and C2 sit on top of C3, C4, C5. And so you've got to make sure there is a relationship. Just like when we teach that if you get fusion, you should expect adjacent segment disease. These are ways to understand that the spine is connected. It's one system. You can think of it like a bicycle chain, that if two links out of all of the links are stuck together, it will affect the entire chain, not just those two links. And not only will it affect the chain, it'll affect the performance of the entire vehicle, or cycle in this case. And that's the same thing with our bodies as well. Let's keep moving on. Lots of interest in this topic, Doc. We got Megan May, who's asking, can it cause muscle weakness? I have full body weakness after neck traction injury. Feel so light.
Yeah, muscle weakness is probably not a related symptom to what we're talking about today. Most people wouldn't describe that. They would just describe dizziness, imbalance, or lightheadedness. Now, muscle weakness can also occur with upper neck injury if there's craniocervical instability, where the spinal cord or the covering of the spinal cord is getting irritated, or if there's cervical stenosis or a large disc pressing on the spinal cord. And that can cause whole body weakness as well. But that tends to be a different sort of set of or collection of symptoms than we're discussing today, but certainly no less important, right? It's always disconcerting to have that sensation of whole body weakness.
Absolutely. Thank you, Megan, for asking that. And it reminds me, if you're watching and you know people that may have these symptoms, this is a good time to invite them. You can do that by clicking the share button down below or typing their name in the comments section. If they're on Facebook, that'll highlight and that'll notify them that this show is on live. They can be asking their questions to Dr. Centeno directly. I'll also pause and mention that when you join this show, you should see a menu that gives you an option to subscribe, to receive notifications whenever we go live. So when you see that, please click, yes, notify you whenever we go live, which of course is Mondays here at the Centeno Schultz page, Friday on the Regenex page. Let's get back to questions. This one was submitted in advance by Tommy Brown, who asks, are these symptoms recognized in lawsuits from car accidents?
Yes, again, these are common cervical symptoms related to the upper neck. So that would be C2-3, C1-2, C0, C1. And if there's a car crash involved and there needs to be some sort of documentation of what might be causing them, then there's a way to get either what's called an ENG or VNG study done with what's called smooth pursuit neck torsion, so that you can document that these things are coming from the upper neck. So a little different there on the car crash side. If there's some sort of lawsuit, then someone might have to document that the upper neck is causing this. Or the other easier way, obviously, to do this would be to treat the upper neck and see if the symptoms go away, which would indicate that, again, these were coming from the upper neck.
Yes, and it very much is about documentation from experts, you being obviously one of the world's foremost experts on this. We got our buddy Damien. Happy Monday. Happy Monday, Damien. Thanks for watching. Appreciate you tuning in. We've got Keith Jackson, name I have not seen before. Here we go. I live in Los Angeles. Whiplash concussion 9 months ago. Still lightheaded and dizzy. What steps should I take prior to visiting someone like you? Imaging, treatment, etc. He goes on to say in another post right here that he's 28 years old. Your thoughts, Doc?
Yeah, so I think a good place to start, obviously, would be a cervical MRI, just to make sure there's nothing that we're missing. A DMX, or digital motion X-ray, is another good thing to get to see if there's any instability or ligament damage. So I think those would be two good things to start with. Obviously, you can see local experts in your community. You could try an upper cervical chiropractor, for example, NUCA, AO, Blair upper cervical technique. There's a couple different types. You could also try to find a highly skilled physical therapist who's got a lot of manual or hands-on experience. So those are the things to consider first. And then obviously, if everyone's still scratching their heads as to what's going on at that point, or if there is something like upper neck instability, then I'd obviously be happy to look at you. But those are the kind of things that we'd be talking about.
Just for clarity, for Keith's benefit, and Keith is responding, I've already got a lying down MRI, thanks. But for everybody's benefit, when someone's early in this process, they're not just going to go to their doctors and go, I need a DMX, I need a MRI, I need a. How do you recommend they sort of navigate this? Do they go through their sort of, traditional insurance, find out what their general physician says, go through all of that? Or should they basically be getting, onto your schedule or someone at Centeno Schultz, do a telehealth consult and sort of work backwards? Here are the images I'm recommending, and here are the people or places or resources you could consider getting those, maybe having them being referred by you or requested by you?
Yeah, so these days, now that we have such widespread telemedicine because of the pandemic, it may be a good idea to start with that telemedicine eval with a doctor at Centeno Schultz Clinic and kind of work backwards. If that's not possible for you to do, then I would say try the imaging workup and/or to try to see the providers that we talked about. But certainly the fact that we have this unique pandemic, which has allowed physicians to be licensed in all 50 states, probably temporarily, or who knows, maybe for good, I don't know. Probably a good idea to start backwards, because we can write scripts now for things like MRIs or other things that might be needed if they're needed.
There you go. So, Keith, I think the recommendation is get in touch with the Centeno Schultz Clinic. Start with a telehealth. If you've already obviously been to doctors, you've already got an MRI, you've already been trying different things. Obviously, you're watching, looking for, okay, I'm not getting help. Where can I get help? I believe the answer would be to schedule an appointment either with Dr. Centeno or someone at the Centeno Schultz Clinic. Get them your MRI imaging, and then they can work with you individually based on your specific case. So, thank you, Keith. If you got more questions, let us know. We will be Judy Sebastian. Judy asks, titanium C1 to C7, 2007 to 2011, re-injured in 2014, dizzy and neuropathy again, retired to Colorado, vertigo. Not sure there's a question there as much as what probably is a lot of frustration and some eye rolling. What are your thoughts on that, Doc?
Yeah, so it sounds like she has her whole cervical spine fused except for C0, C1. So that would put immense pressure on the C0, C1 joint. And certainly in another car crash or another injury, then all of that force is going to go to that level, which can cause dizziness and vertigo. So I think the biggest thing would be getting that checked out at C0, C1, because that sounds like the only level that isn't fused right now.
There we go. Our heart goes out with you, Judy. That is a frustrating place to be. That's supposed to be moving, and stuck like that has got to be hard. So we're empathizing with what you're going through. Justin Shannonhouse says, I've had a DMX, and there is not a ton of C1, C2 overhang when side bending 2 millimeters. There's a lot of crepitus and grinding when side bending and rotating coming from the upper cervical. What would you suggest treating? Injury from chiro twisting on my neck 3 years ago. Thanks. Your thoughts?
Yeah, so it's not only that type of instability that we would look for on DMX. There are other things we would look at, such as the atlantodental interspace, or more recently, we had a really interesting case of a patient who had a lot of instability at C0, C1. So bottom line is, there still may be instability there. I don't know that specific case or that specific instance. So that's something to consider. The second thing would be, if we're not sure if there's instability, then the next best step is usually to treat the high upper cervical joints with a high dose platelet-rich plasma injection to see if we can get those symptoms to calm down. So those are sort of the two things to be thinking about there.
Yeah, he goes on to say there is also dull, constant pain that gets worse when sitting, and suboccipital exercises help with pain, but always very temporary. You sound right. He mentions crepitus and grinding, which would seem to indicate instability. Anything else to mention to him?
No, I think those are the things to consider. Just realize at the end of the day that we may or may not be able to find where the instability is. We certainly have treated patients where we've worked them up and there's clearly an upper cervical injury. There's clearly clinical evidence of instability, but we can't document it well on imaging, and those patients have just gone forward with that PICL procedure. So that's something to consider.
Yeah, so that sounds to me, Justin, like you've got the imaging. Maybe schedule an appointment with Dr. Centeno or someone at Centeno Schultz. Have them review it. The DMX is not the only indicator. It sounds like there may be some other things that might indicate there's some instability, and there's only one way to find out what's going on with you specifically, and that's to schedule a time to find out what's going on with you specifically. So please reach out and make that next step. Judy wanted to say thank you. Judy, you're welcome. We hope you get well and stay well. Megan goes on to ask, can regenerative medicine improve tracking of cervical bones together?
Yeah, so let's talk about that, because I think what's being talked about there is stability, right? So a joint that's stable will track very nicely. And there's two things that allow it to track very nicely, meaning that all the joint surfaces as you move stay together in the right alignment. One of those would be ligaments. The other is muscles. So So can regenerative medicine improve that tracking? The answer is yes, if we can get the ligaments to tighten down. But the other half of that equation is muscles. So that person is going to need to build some of those atrophied muscles in that area in order for them to have full stability. Because remember, ligaments provide stability at the end of the range of motion. In the middle of the range of motion, it's the muscles that provide that stability. So we need to get both of those back online.
Those are great questions. Thank you, Doc. And I just want to credit everybody, watching and asking, that it's great to, ask questions that help you understand what's happening. Because the more you understand really the miraculousness of your body, the ability it does have to heal itself and to adapt to all of these different injuries that all of us are accumulating, it's pretty miraculous and pretty awesome. So thank you for asking that and understanding how your body works. Megan goes on to say, no, that was her question. Justin says, thank you. You're welcome. Megan says, yes, thanks. You are welcome. Megan then goes on to ask, how do you retrain, rebuild those unique muscles? She goes on to say, mine were perfect before the traction injury.
Yeah, realize that what your body is trying to do there is it's trying to shut down the area or to stabilize the area. So on the shutdown side, the muscles tend to just atrophy or stop working like they're supposed to because your body perceives that having them work might harm you. Or on the other side, on the spasm side, your body is trying to lock down the area as best it can. But even then, those muscles aren't designed to do that. So they frequently wear out and then become atrophied. So how do you get that strength back? The first thing is you've got to get the ligament stability back, because a lot of people with instability can't really exercise because it causes things to flare up. And that's usually an injection-based treatment where we're trying to focus on tightening down those ligaments. And then the second part would be a very specific strengthening program focused on those muscles.
Yes, very good. Thank you, Megan. Hopefully that is helpful for you. Justin goes on. Justin Eddy says, any update on the clinical trial being done on PICL? Do you have any idea of when it will be completed and when the results will be published? And do you plan to discuss the results in your upcoming book on CCI? Thank you.
Yeah, so we're a long ways from completing that clinical trial. I wish it were recruiting faster. I think the problem we have with CCI is a lot of patients really want the certainty of knowing that they are going to get treated right now, because their life is sort of in a living hell, so they're not really willing to put themselves into a trial where you get either the treatment or a placebo, meaning non-treatment, but you think you got the treatment. So I think that's one of the problems. It's certainly kicking along. We're moving forward with it. I think we are at about 15 or 16 patients out of 50 that we approved for the trial initially. And those people either get the procedure or a placebo and then cross over into the other group. So at the end of the day, I think that we will get it done. It's probably going to take several years to get it done. Now, if we had a lot more people that were willing to let themselves be randomized to no treatment, which would be a placebo, we could probably get it done much quicker. But I think the reality of how awful that problem can be is inhibiting some people from wanting to be in a study where they might get a fake treatment.
The joys of science. Okay. All right, Tamara. Tamara Richardson asks, how quickly after PICL do these symptoms clear up? That's a great question.
Yeah, generally the dizziness imbalance piece tends to be pretty quick. So normally after the first or second treatment, we're seeing most patients have those issues resolved. Now, it's certainly possible that they might not, in which case we might have to look for other causes or other treatments that might need to be done. So for instance, the biggest one we tend to see when those don't go away is there's also sort of a visual tracking issue that might need to be dealt with in optometric type physical therapy or seeing a vision therapy specialist. So, but usually they'll clear up within that first one or two treatments.
Very Good. Tamara, if you've got questions you'd like to schedule a time, then please reach out to the Centeno Schultz Clinic and find out what is available for you. All right, this is a very kind comment. Shannon Alita, thank you. She says, you have no idea how helpful this all caps accurate medical information is for millions. Thank you for being brave enough to offer this publicly. The Hippocratic Oath is desperately needed, and you are a godsend. With lots of emojis of celebration. And Shannon, thank you. Kind of you
Thanks,
to
Shannon.
say. Yeah, kind of you to say. We certainly appreciate it. We're not doing this for our health. We're doing it for yours. So thank you for acknowledging that and appreciating it. That's why we do what we do. Our good buddy Tom. Hey, Tom. He says, hi, guys. Can strong neck muscles take the pressure off of a degenerated cervical discs?
Yeah, so there's two concepts there, Tom. One would be gravity type pressure, and they're probably not going to do that per se, but there's another factor there. So there's a couple of things going on there. One is that you've got to have a normal curve in the neck to get half of the weight of the head put forward on the discs and the other half going towards the joints in the neck. And if you've got that type of configuration, then that will help quite a bit. So muscles can aid in that, in taking some weight off the disc. Then you've just got gravity pressure. Obviously, there's not much going to happen there. But then you've also got wear and tear on the disc that happen due to instability because there are weak muscles. So I'll give you a great example from my own personal life. I have pretty severe cervical stenosis because I got a big head. I was born with a big head. In fact, it was hilarious when my son was born. The pediatrician initially thought he might have hydrocephalus because he had a large head. And then as soon as I walked into the room, he goes, oh, no, this isn't hydrocephalus. I see the father, we're good. So long story short is it puts a lot of pressure on my cervical spine. It's led to, as I've gotten older, some cervical stenosis. Now, 5 years ago, I had a real severe flare-up. We got it calmed down promptly using orthobiologics. At the same time, I had an acquaintance friend who had a similar flare-up. She went on to cervical fusion. I think she's miserable right now. I never did that. But I will tell you that when my neck muscles and the nerves are irritated just a little bit, my neck muscles will shut down. And what I will hear is much more crepitus, meaning much more popping, cracking. And it's because those little muscles aren't doing their thing to allow those bones to stay in alignment as I move. So when that's happening, I'm getting more wear and tear on the disc. So what do? I mean, literally just simple, slow cervical range of motion, plus opening all of this up will make a tremendous difference and get them back online, reducing that wear and tear. So muscles can serve to reduce the wear and tear both by increasing and maintaining the curve, and also by allowing alignment as you move your head between the vertebra and thus reducing the wear and tear on those discs.
Great question, Tom. Thank you very much. That's all the questions we do have. We're at the half hour. Doc, this is a very common issue as we see, all these injuries in the upper cervical part of the spine, the CCI, CCJ, the upper neck where the brainstem passes through can have all kinds of implications to your health, your symptoms, your recovery, etc. Tom, you're very welcome. He says, thanks, Doc. We appreciate it. Doc, let's wrap up what people need to know for this subject today, and then we'll close up and invite you to join us on Friday. Your thoughts?
Yeah, so I think the thing to know is that dizziness, imbalance, and lightheadedness can come from your neck. It's not an uncommon thing. A lot of times people go down these rabbit holes. And listen, it should be worked out for all the common things that can cause that. But if those workups come back negative, then just make sure, if you know someone out there who has that issue and they're scratching their head, I don't know why this is happening to me, share this video with them so that they can understand that it can be coming from their neck and why, and so that they can also get the benefit of all the great questions asked here today, because that also unearths more things for those people who weren't on today, but they're like, oh God, that sounds just like me. And that's an incredibly important thing for a patient to identify themselves and someone else's complaints. So please share it if you get a chance.
That's what it's all about. As Shannon said earlier, many of you don't know, many of you do know, but many of you don't know how hard it is to find help, to find a credible, trustworthy doctor that is able to tell you the truth. And I know that sounds ridiculous, but in many of these larger facilities, doctors can say certain things and can't say certain things. And often they can't say certain things about the things they don't provide as a service. And wouldn't you know it, orthobiologics and regenerative medicine is often that topic. So you've got to understand where you can go to get this kind of information. This is the easiest place, the freest place for you to be able to ask your questions about your condition, about what's going on, what you're feeling, why you're feeling it, and if help is available. So as we wrap up today, let's just reiterate. If you know someone that needs help, please share this program with them. If you are wondering whether you have coverage for these types of procedures, there's a website set up called regenxcoverage.com, and there's up to 8 million people out there that have coverage for your next Regenx procedure. Find out if you're one of those people that has an employer covering your next Regenx procedure. Doc, we'll wrap up for today, but thank you everybody for watching. We will be here on Friday at the Regenx Facebook page. As you know, for those of you who are new, Mondays we broadcast live here on the Centeno Schultz Facebook page. Fridays we go to the Regenx Facebook page. We'll see you in both places. Please subscribe, please share, and thank you for asking your questions and sharing this program with other people. Until Friday, stay well everyone. Thanks for watching. We'll see you then. Thanks everyone. Bye-bye.